distribution of health workers through targeted incentives for health workers who agree to serve in underserved areas. Let me use this opportunity to appeal to our gallant health workers to accept postings to our underserved areas, seeing as it is a national call to duty while we work to ensure that they have an enabling environment to do their work. Mr. Speaker, we'll also scale up specialist and advanced nursing training to match the country's changing disease profile. New post-basic nursing programs in cardiology, nephrology, endocrinology, and oncology will be introduced. While the two existing ones, emergency and critical care nurses, will be scaled up. At least 30 nursing training institutions will transition to competency-based degree curriculums, supported by new scholarship opportunities for PhD-level training for nurses and allied health professionals. Mr. Speaker, on health infrastructure, my government remains firm in its commitment not to abandon unfinished projects. We'll continue to retool facilities, strengthen emergency and disease surveillance systems, and ensure that health infrastructure is properly aligned with staffing, equipment, and financing. In 2026 budget, provision has been made to commence regional hospitals in Oti, Savannah, and the Western North regions. This will expand access to quality care. Aligned with the reset agenda, we're making strategic investments in local pharmaceutical and vaccine production. The government has allocated 50 million in seed funding to the National Vaccine Institute. And in 2025, a local manufacturer secured market authorization to produce snake venom antiserum right here in Ghana. We're also finalizing steps to implement an advanced market commitment to prioritize locally manufactured vaccines and pharmaceuticals in public procurement. Production of the tetanus diphtheria vaccine is expected to commence this year through a partnership with an Indonesian pharmaceutical firm. Disease control remains our priority in our country's immunization financing. We will strengthen immunization financing. In 2025, the vaccine budget for children and pregnant women was increased by 46%, exceeding the 171 million Ghana cedis. And this enabled Ghana to fully and promptly finance all its vaccines and reduce the risk of preventable outbreaks. In 2025, we also introduced the HPV vaccine to protect